Dandi local government area in Kebbi State, northwest Nigeria is home to this 20-year-old young woman I want to address as Jamila, whose real name I am withholding for protection purposes. Like many of her peers, she was given out in marriage about 2 years ago to a man far older than her. Having endured harrowing days of spousal abuse, she was unable to conceive until the year 2022. After 9 months of her pregnancy, her delivery turned out to be a nightmare because of prolonged labor. Consequently, Jamila ended up undergoing the excruciating pain of vesico-vaginal fistula, otherwise known as VVF.
It was in the early hours of morning when I started labor, and I delivered after some hours. But after the delivery, I felt something flowing from my vagina, which I thought was blood, not knowing that it's urine. It flows without control, and at that time, I was not taken to the hospital. We collected medicine from different people in my village, but not successful. My mother brought me here, and I have been at the hospital for almost a month now, but neither my husband nor his relatives ever visited me.
Fistula cases are due to prolonged obstetric labor, and in prolonged obstructed labor, there is compression of the bladder and the vagina against the woman's pelvis by the head of the fetus, resulting in death and sloughing of the tissues. So in this, and there is also iatrogenic cause, which is hospital induced. There is also yankan gishiri, there is yankan guria. These two are yankan gishiri and yankan guria are harmful traditional practices. There is also FGM, which is also part of the harmful traditional practices. Also offers free treatment for our patients during the hospital stay of period of 4 weeks. There is also feeding is also free for our clients. Also, there is a accommodation available for patient relatives during the period of stay of the patients in the facility.
6 months after, her husband gave her a letter of divorce, which is not unusual in this area. And as if problems were not enough, she also had to endure the trauma of stigmatization. Jamila is not the only one. I also met 35-year-old Bintu from Birnin Kebbi, the state capital, whom I am also withholding her name for protective purposes, suffering from the trauma of VVF. In her own case, VVF was inevitable because she labored for 2 days before she could get any medical help.
I got the problem during delivery and have been with the condition for 2 years now. I have a prolonged labor at home, after which I was taken to the hospital and delivered through cesarean section. 2 days after the CS, when I stood up, the urine began to flow, and I immediately told my mother, who was close to me.
Jamila and Bintu represent the ratio of women who have gone through the trauma of VVF with a prevalence of 2.3%. According to the Nigerian Demographic Health Survey, Kebbi State has a prevalence ratio of 1.4% among women aged between 15 and 49. In fact, in the year 2020, the Kebbi State Ministry of Health reported 1,250 cases of VVF, while the Federal Ministry of Health estimated about 5,000 unreported cases of VVF. This places Kebbi State in one of the highest VVF prevalence rates in Nigeria. Today, this figure has gone up, and the risk factors include early child marriage and childbirth, lack of access to quality health care, poor health infrastructure, limited education and awareness, as well as cultural and traditional practices. This has led to the establishment of the only VVF center in Kebbi State. It was established to provide free repair surgeries, socio-economic and psychological care to victims who have the courage to speak out. This is where I met Jamila, Bintu, and a host of other women who are lucky to have been able to get free surgeries done.
VVF is one of the most dehumanizing affliction of womanhood worldwide, more prevalent in developing countries as a result of childbirth complication. So the futures, there is continuous uncontrollable leakage of urine or feces few days after delivery. There is continuous smell of urine with consequent social effects such as stigmatization, low self-esteem, and also depression to some extent. The husband and the family and society may abandon the woman and she becomes an outcast.
The challenges of this home are unending.
One of the challenges also is the need for solar powered system to preserve blood bank and also lighting at the theater, wards, and skill acquisition center.
Then I came across this man, Dr. Abdullahi Hussaini, who has been the only VVF repair surgeon in the last 4 years in the state. I was shocked when he told me that there was a backlog of about 10,000 victims who are yet to be operated, at least among those who have spoken up.
We are having in the state and why there's persistent cases of clients having VVF that I would like to approach it at two levels of management. Firstly, the preventive level. For the preventive level, we have over 90% of our clients have little or no formal education. They have poor health-seeking behavior. They are ignorant on on what obstetric fistula is, and we have inadequate human resources in our secondary healthcare facilities. We have only one fistula surgeon in the state. We have one fistula center in the state. So you see reasons why we have a lot of backlog of fistula clients in the state. So in that aspect, we need more fistula surgeons. We need more hospitals that are rendering fistula services. For improving in fistula surgeons, we need employment of doctors and trained to be fistula experts.
Dr. Abdullahi works for a non-governmental organization known as Momentum for Safe Surgery. The organization has just ended its project in Kebbi State with probably no means to continue the kind repair gesture. This simply means the existing gap already created will continue to grow wider. What then is the way forward?
We need to improve girl-child education, improve in health education, especially the need to seek for healthcare as soon as possible, improve in two-way referral system across all the facilities, improve in our ambulance services across all the facilities, and training on CMONC, which has 9 signal functions in all our secondary health facilities. Momentum Safe Surgery in family planning and obstetrics support the state, the Ministry of Health and Ministry of Women Affairs in training healthcare workers on CMONC, including cesarean delivery, and also other important aspects of the services secondary healthcare facilities rendered.
There are so many verses and the hadiths of the Prophet ﷺ that giving right to less privilege, most especially women and children. So if we can bring ulama, imams and other things into this, inshallah, within this state that is predominantly dominated by Muslim, we can use it as another alternative in fighting the gender-based violence in the state.
Very volunteers are going down to the communities and fetch out all these problems and issues, and actually with their own help, we can tackle this very gender-based violence issue to the minimum level.
Although efforts are on to combat this disease, the gap between reduction and elimination of cases is still far from ending soon, not only in Kebbi State, but in the northwest region of Nigeria as a whole. This story is part of the African Women in Media Reporting Violence Against Women and Girls project, supported by the Wole Soyinka Center for Investigative Journalism.